Alright, so what's up? I'll be talking about the next drug, which is what? Azosemide. Azosemide. Okay. So for this azosemide, I'll be running through its pharmacology. So you get to see that azosemide is usually sold under the brand name what? Diucardin. We're not saying this is the only one, but mostly you see it in this label. Diucardin. So for this diucardin, you see this azosemide. We say that it's actually a loop diuretic. So it's used to treat what? Hypertension, edema, ascites. Okay. What's the mechanism of action? It actually inhibits sodium and chloride reabsorption. Okay, that's a salt. Okay. So it inhibits sodium, potassium, chloride co-transport in the thick ascending limb of the loop of Henle. Before you are coming to talk about the drugs, you must have maybe had all those lectures on the kidneys and all of that. So it has a diuretic and antihypertensive effect. So it reduces what? Extracellular fluid volume. This will now lower blood pressure. It reduces edema too. Okay. Pharmacokinetics. For absorption, it is the bioavailability is approximately what? 20.4. And peak plasma concentrations are achieved in 3 to 4 hours after oral administration. Distribution is actually highly protein bound. So about 95% of it, okay, protein bound. Metabolism undergoes considerable first pass effect. Metabolism of first pass effect, that's in the liver, which makes what parenteral administration more effective than oral administration. So that means if we give it through the veins, it will be much more effective than. Sorry, I was trying to check something. More effective than if you give it through the oral route. Excretion is so that it's actively being excreted in the renal proximal tubule. Right. Duration of action. The effect of azosemide lasts for about what? 6 to 12 hours when you take it. Half-life is approximately what? 2 to 4 hours. Right. This is biochemical structure. Indications, that's which disease conditions do you use this? So ascites, edema, right? Ascites mostly seen in hepatic cirrhosis. Then hypertension, that's when you're having high blood pressure. Adverse effect, it can cause electrolyte imbalance. So you can be having what? Hypokalemia, low potassium levels. You can be having what? Low sodium levels. You can be having low magnesium. You can be seeing what? You can also be having what? Low calcium. So a lot of problems, right? So other effects is what? There's potential for dehydration, hypotension, that's low blood pressure, dizziness, and in rare cases can cause and it can be toxic to your ear. It can be toxic to your ear. Okay. So moving forward, contraindications, as if somebody has hypersensitivity to azosemide or any loop diuretics, you don't use that drug on. Anuria. So it should not be used on patients that completely are not producing urine. Okay. So drugs interaction, it can interact with what non-steroidal anti-inflammatory drugs. So you should watch how you prescribe this drug with what other in combination with non-anti-inflammatory drugs. Okay. Lithium, it can also interact with lithium. Then aminoglycoside and C-plastine can also interact with it. Then monitoring parameters, you have to be monitoring what? Electrolytes when you're giving this drug, and also renal function because it can be toxic to the kidney. That's nephrotoxicity. Right. So this is it for what? Azosemide.